Okay, so this presentation is about diabetes and how to prevent it. So first of all, what is diabetes? Diabetes is a disease that occurs when your blood glucose levels are too high. And so normally when that happens, our pancreas releases insulin to lower our high blood sugar, but people with diabetes are not able to produce insulin, so it's a lot more dangerous for them, and they have to take insulin every day. So there's two types of diabetes. There's type one and type two. So type one is you're normally born with it. You can't like develop it. You're usually born with it, and it's diagnosed early on in life. And people with type one diabetes cannot produce insulin, so they have to take it every day. And then people with type 2 diabetes, you can develop it from an unhealthy lifestyle, so not eating well or not exercising regularly. And it's most common in middle aged or older people. It can develop in children, but it's more common in the older population. And it is the most common type out of the two, or the three. And then the third one is gestational diabetes, which can sometimes develop in pregnant women, but then it usually goes away after the baby's born. It does increase your chances of getting type 2 diabetes, so you just have to be careful of that. So, genetics do play a big role in diabetes. So, type 2 diabetes is more likely to pass genetically than type 1. And it's because like obesity tends to run in families, and families have similar eating habits and exercising habits. Um, so you just have to be a lot more careful with your child if type 2 diabetes does run in the family, making sure they're living a healthy lifestyle. So the negative impacts are heart disease, strokes, kidney disease, eye problems, dental disease, nerve damage, foot problems, also called a gout, which is like when your feet like and ankles like swell up and they get really big. Um, and that's because of all the extra weight up top. So, yep. And then who's at most at risk for type 2 diabetes? So, people that are like the middle aged people, 45 and up, those with a family history of type 2 diabetes, who also don't exercise very much and eat a poor diet. You want to eat lots of fruits and vegetables, not a bunch of fast food and greasy food. And then those with high blood pressure also have a high risk of developing type 2 diabetes, um, pre-diabetes. So that's like, it's still just as severe and usually leads to type 2 diabetes. And then women who had the gestational diabetes while they were pregnant. And so, how do lifestyle choices affect diabetes? So, the way you eat, if you eat, pizza and all this and fast food every day, and a lot of sugar, you're gonna increase your chances of developing type 2 diabetes. But if you exercise a lot and you eat a well balanced diet, eat lots of fruits and vegetables, then you're gonna lower that risk. And smoking can also increase your risk of diabetes if you're smoking with a poor diet and you're not very active. And then here's my sources page.